All right, hi everyone. Yana Ludwig here. I'm running for U.S. Senate in Wyoming, and today's topic is single payer, also known as Medicare for All. So I'd like to start out by just getting a pet peeve of mine out of the way. I'm pretty bummed out that the phrase Medicare for All is the one that caught on. A whole lot of people, including my own mother, hi mom, have expressed worries about about everybody getting onto Medicare because frankly, it sucks in some ways. Medicare as it currently stands has a lot of the same faults as private insurance. There's all the complications with copays and deductibles and premiums. There's all the paperwork. There's agonizing decisions about whether you add on pieces of coverage this year that you may or may not use when you're on a limited budget, and having to navigate with your doctor this balance between what is covered and what is needed. So nobody likes any of that stuff. But Medicare for All has become the shorthand in part because, in spite of its flaws, Medicare is actually one of the most popular government programs that the US has ever come up with. It was basically a question of branding, which was smart, but now that a bunch of us are out here trying to advocate for it, we end up in some very convoluted conversations using that phrase and then having to immediately kind of back away from it. I like single payer instead, and I'm going to go back to using that. And I like it in part because it describes in the title itself one of the big problems with our current healthcare system. There are so many different entities paying the bills. We have multiple government programs, multiple private insurance companies, and then there's uninsured individuals. You can't actually find out how much something would cost if you call and ask because all of those entities are charged different amounts. And often uninsured individuals are actually charged the most because we don't have the advantage of contracts putting caps on fees the way that private companies and the government do. The problem is that the word Medicare for All, as championed by Bernie Sanders and endorsed by me, is not really like Medicare at all in some key ways. What we are proposing is full coverage, doctor's visits, all needed tests and procedures, mental health, reproductive health, vision and dental, prescriptions, and long-term care would all be included. If you need it, you will get it without having to navigate some complex set of decisions about what's covered, where the lines are between these different categories, whether someone is in network or not, and a whole bunch of other pesky questions. You can just get your body and mind taken care of. That's the coverage of Medicare for All. And the more accurate label for it probably is single payer because it would eliminate private insurance. And I'll come back to why in a few minutes. But first, I want to share a video clip with you where I'm explaining the math and how it would impact individuals. I made this video in response to Senator John Barrasso and his pretty deceptive talking points about Medicare for All. So I'm going to go ahead and share my screen with you. And then, oh no, I'm getting a thing that says I have to install an audio device in order to be able to share a video on Zoom. Darn it, it didn't do that when I tested this out earlier. Okay, so I'm just gonna reference for people. There's a video on our YouTube channel called Johnny versus the Scary Socialist. And what that video does is I walk through the ways that it would actually, for most people, be pretty darn cheap to get on Medicare for All the way that we have. Oops, is it sharing? I want to stop share. Nope. Okay, there we go. Sorry, glitchy today. What I actually do is I walk through the way that the system is actually proposed under Bernie Sanders' proposal. So basically, if you make $29,000 or less in a year, it would be free. Above that $29,000, it ends up being a 4% tax. And that is what replaces your premiums, deductibles, copays, all of the various things. The one charge that you may still end up with is about $200 just for prescriptions. And so over the course of the year, 4% of your income above $29,000, $200 for prescriptions, and that's pretty much it. One thing that I don't see in that clip is that, so Senator Barrasso says at one point, like, that it would be terrible for the 180 million people in the US who get their insurance through their employers. But as of 2 weeks ago, about 27 million of them have actually lost that coverage. So that is almost 1 in 6 people who thought that they had secured insurance for 2020. And Donald Trump has refused to reopen enrollment in the Affordable Care Act marketplace, in spite of the fact that you're actually supposed to be able to enroll partway through the year if you've had a change in circumstances. And that means that people are not being able to access those private insurance subsidies through the ACA. So tying insurance to work is incredibly unstable for the workers. It also gives big corporations a huge advantage in recruitment of employees over small businesses who have a lot harder time affording great benefit packages. So if you love small businesses, you should hate our current system. My hands down favorite thing about the Sanders version of Medicare for All is that private insurance goes away, thus single payer. Why do I love it so much? Basically because private insurance is kind of a scam. First, there is the fact that we spend about 30% of our overall healthcare expenditures in the United States on private insurance that actually isn't getting us anything. Basically, what we're doing is giving them 30% of our money that we spend on healthcare for the ability to gatekeep what we're allowed to get access to. And basically, any plan that keeps private insurance as an option, when people talk about a public option, they're talking about keeping private insurance and creating a public track. Anything that keeps that private insurance option is just giving permission to those big companies to keep abusing us for profit. Second, if we have that kind of dual system, private insurers are just going to dump the most sick people from their insurance or jack the prices up so much for those of us with chronic conditions that we will all end up on the public option anyway. And on the surface, that doesn't sound like a problem. But part of why insurance is profitable is because everybody pays in every month, but only some people actually have to use it in any given month. Healthy people are bigger profit makers for private insurance. And if they know that you have someplace to go to get coverage, they will have no reason to keep ill or high-risk people on the rolls. And that is going to lead to the public option costing us as taxpayers a lot more money. Private insurance is the mechanism that will make everyone's fears about public sector health coverage being horribly expensive come true, but only if we keep that door open for them to do it. Finally, unlike what Senator Barrasso has been telling people, this isn't a government takeover of the healthcare sector. It is the government becoming the bill payer. That's it. It's just like Medicare and Medicaid in that one way. We are already doing it for millions of Americans. It would just simplify the billing process immensely for doctors and make it so that there is just one price for services. Your doctor would still have their private practice or work at their private or public hospital. The government would not suddenly own all of it. Now, as a side note, we do need to look at the level of fees that would be paid out. Currently, Medicare does pay less than other payers for the same services. And I think that some hospitals and doctors' offices are rightly concerned about not making enough to keep their doors open if everybody was on Medicare, which again, they wouldn't be, but that's where the fear comes from. We have to take care of our medical community, and we should be looking at reanalyzing what sustainable payments are. There is one place, however, where I would like to move it to public utilities, and that is the pharmaceutical industry. Big pharma executives make some of the highest wages of any industry in the country. Some estimates have said that CEO to worker wages within big pharma is about 1,000 to 1. Now, I keep saying this in different videos, but there is no way that anyone's time is worth 1,000 times anyone else's. So I would love to see the pharmaceutical industry broken up and not nationalized, but turned into state-level public utilities. Why do I want that? Well, many of our state budgets could really use the money, including Wyoming's. even with 100% profit on drugs, in other words, they make it for 30 bucks and they sell it for 60, they'd be charging far less than pharmaceutical companies are now, where in the United States, sometimes the cost to you is 30 times what it costs them to make the thing. And they'd still be able to make a tidy profit that can then go into the public good. Besides, a lot of the drugs that have been patented in the US were developed using public research funds. That's right, we allow companies to use our money to do the research and then patent the drugs for their profit. So if you are offended at all of these huge corporate bailouts happening right now, which I think you should be, I invite you to be even more offended by the systems we have in place that every year take your hard-earned dollars and hand them over to a company making billions of dollars of profit a year. And that's just normal business practices. So the time is very good right now for a whole lot of disrupting business as usual in our healthcare system. Okay, that's my spiel for the day, and I'm going to open it up now and invite Glenn Houlihan to share a little bit about his experience being from the UK, where they have the National Health Service, which is similar to what we're proposing here. So, hi Glenn, good to see you on our Sunday date.
Hi, Yana. Thank you so much for that. And yeah, thank you for just giving me a minute to talk about the NHS. So for those who don't know, the National Health Service started in the UK post-World War II in 1948, and it basically established healthcare for everyone. It recognized immediately that healthcare shouldn't be a privilege for those who can afford it. It's a right for every single person in the country. So yeah, there are differences, but there are also a lot of similarities with the system that Yana talked about. But when friends in America ask me about it, I usually simplify it just to a few simple points. So what does the NHS mean? It means no premiums, it means no deductibles, there's no networks, and that's super, super important because a key talking point, I think, for advocates of the current healthcare system in the US is that you have choice. And I argue as someone from the UK, you do not have choice. You are bound to these networks, which you are paying specifically for. By contrast, in the UK, if I broke my arm in Liverpool, and I was just there visiting on holiday, and I'm from London, it doesn't matter. You're going to get fixed. There won't be any extra bills. And bills is another fundamental part of it. There are no bills. You do not get charged to use healthcare. It's funded through general taxation and national insurance contributions. And there are currently small levies, which are paid through by small prescription charges and things such as that. However, if you can't afford these prescription charges, if you're in a low-income family or if you're low income yourself, those charges aren't actually taken from you. So it really is the net cost to you as a consumer of the healthcare is nothing. And it just blows my mind when I see the cruel, callous system we have here in the US, which prioritizes your access to healthcare through your income, which I think is fundamentally wrong. So I have pre-existing conditions, right? I have severe allergies, and the comparison I always make when having this discussion with friends here in America and friends back home is that 2 EpiPens that are life-saving. I've had to use one once in my life, and it was the scariest moment of my life. 2 EpiPens cost $700 currently, give or take, here in the US. Those same 2 EpiPens, the same manufacturer, cost $15 in the UK. And if you can't afford those $15, again, if you're low income, you don't have to pay that. So it really does blow my mind when I see the difference in care. And it really scares me because, I'm used to something. And I think a lot of us in the UK take it for granted, but I'm used to something that's very good. It's a very safe structure. And if I don't feel scared to go to the doctor back home, right? I don't have to weigh up this cost analysis in your head between, can I afford to see a doctor? That isn't ever an issue. It's like, am I sick? Yes, I should see a doctor. And it's just such a different way of viewing healthcare. And it makes me so happy that we have it back home, and it makes me so thankful. But it also makes me so miserable when I come here and I see friends who can't afford treatment for cancer. They can't afford treatment, even, of course, we're talking about COVID now. There's a debate, it almost feels like, in America, whether the vaccine should be free, et cetera, whether treatment should be free. Thankfully, back home, these aren't really debates. It's like, if you're sick for COVID, you go to a doctor and they try and keep you alive. It really is as black and white as that. And yeah, that's why, we've discussed the naming of Medicare for all and specifics of it, but that's why I think a single payer system is so vital. to, you know, to ensuring equality in healthcare in America, because it's just so wrong and it's broken. And it's only, you hear about it in the UK, and there's a lot of good videos on Twitter where Americans interview British people and they say, how much do you think this treatment costs?
Oh,
I
those are
mean,
brilliant. I've seen those.
they're
Yeah.
hilarious.
Yeah.
But that was me when I came over. I
Uh-huh.
had Amherst 2 years ago, and I actually broke my arm in America. And I got bills for over $1,000 for the ambulance. It was a 15-minute drive from Amherst to the Northampton Hospital, and the charge was over $1,000. And you had to pay per the mile, like an Uber. And then there'd be miniature charges. It's itemized for every single drug they give you. You don't even consider this back home. You know, if you're ill, you're ill. It really is as simple as that. And that's why I'm a massive advocate for a single payer system. And I just think it's so wrong how people think they should have to choose, especially in families. They should have to weigh up, should my kid go to the hospital, or should we take the risk that it's not going to be that bad? And no one should be uninsured. You know, 13% of adults and 10% of kids here in Wyoming have no insurance. That is so, so, so wrong. And yeah, it's something I'm passionate about, and I'm always happy to speak about it.
Mm-hmm. Interesting. Now, you might not know this off the top of your head, but do you know what the differences are in health incomes in the UK versus the US? Like, are people generally healthy, living longer, that kind of stuff in the UK?
That's an excellent question. From my recent analysis of it, it was reasonably similar, but the cost we're paying, as we know, Yana, per head in the US, it's way, way, way more. We're paying more per person in America for the healthcare, and the outcomes aren't necessarily better. Quite often they're worse.
Mm-hmm.
I think Canada is always a really useful comparison point, especially with the geographic similarities. Um, and just, you know, insulin is something that always gets me. It's like no one should be rushing insulin in Canada, and in the UK that's not going to be an issue. Like, diabetes is obviously a life-threatening condition, and people are dying every single day because they can't afford the treatment they need.
Right.
And you mentioned it earlier, but it's the competition, and you know, and trying to really jack up these prices for things that should be considered, you know, a service to people that people should have. If you're ill, you should get this treatment, right?
Mm-hmm.
Um, and it's just, you know, the lobbying. It's just the big pharma lobbying. It is really, really hard to escape that. And it's a wasteful system. Again, as you mentioned, you know, the administrative costs in the US are so, so high. We should, you know, take out that middle layer and just say, you know what, it's doctors, it's healthcare, and it's patients, and it really should be simpler. And CEOs of big pharmacy companies are among the highest paid CEOs for any industry in America. It should not be that way. And again, that's something that, you know, this campaign, you know, puts a real focus on this complete disconnect between workers' wages and CEO wages. And the healthcare industry, I always think, is a perfect focal point for that. It demonstrates day on day how broken that system is and how uneven it is.
Yeah, it is an interesting thing too, that thing that you were talking about where we sort of have like tiers of like um access, and it's almost like if you're poor, you're a second class citizen in the US in terms of what our healthcare industry is. And it's so interesting, like the insurance industry, you know, do you know the roots of insurance in the United States? I don't know how many people know this
No.
history. Well, it was originally so back in the days when we were like just post slavery, and like Black people were coming out and they didn't have a lot of access to resources. It was actually originally a like a mutual aid fund where people would put money in, a little bit of money in each month, and then whoever would get sick would be able to pull from that fund so that they could get to the doctor. And so it was this very direct, we're in this together kind of thing. It has just ended up so utterly bastardized into this like commodification and profit center thing, instead of like really genuinely having it be pooling your resources so that you're kind of in this together. Instead, like a bunch of very wealthy and increasingly wealthy people are just like skimming a whole bunch of money off the top of that and making a whole bunch of profit off of it. And that was absolutely not the original intention behind insurance.
Yeah, it's been twisted. I think that's a perfect way of putting it. And you know, when medical bills are, of course, you know, the highest reason behind bankruptcy in
Right.
the country. how is that right? How can anyone look at these pretty clear stats and think, oh, that's okay? A
Mhm.
family needs treatment, they're going to be bankrupt for it.
Yeah.
Morally, it's abhorrent. I just can't quite get my head around it, and it's one of those things culturally where that's why I love getting on these campaigns and fighting for healthcare for everyone, because it's just not right, and it just
Mhm.
upsets me so much. Especially it's not just these distant stories. You see it in the news every day. Like when I was in Amherst, just one story I always tell is a lady got her foot trapped in like between a train track and the train and cut to the bone. And the first thing she said was, "Don't call the ambulance. I don't have health insurance."
Oh my God. Oh,
No, it's these stories, and they just every day they happen every single day.
yeah.
Not everyone's reported,
Yeah,
and
and I have family members who delayed surgery for like years past when they I have a friend who has had a hernia for a decade and hasn't gotten it fixed because he has no health insurance. And and I know I have family members who have really taken risks, like heart surgery delayed kind of thing. And people who, like, my husband and I actually went to Mexico to get dental work done because it's actually cheaper to take a week off work, drive to Mexico, spend multiple days in a hotel, eat out the entire time, and drive back and get the dental work done. And it's like markedly cheaper than just going to the dentist here. And I don't think that's like dentists' fault. I mean, part of it is that in Mexico, like, college is free, and so like medical practitioners don't have the level of bills that they have here. They don't have the kind of debt that they have, and so there's this relationship between like student debt forgiveness and medical costs that, like, we're not really looking at very holistically, I think, in this country. And it's part of why, like, I pair those two things together. Like, I think we should have single payer healthcare and student debt forgiveness. And then all those doctors that are like a little stressed out right now about like what happens if everybody's like on Medicaid, are we going to be bringing enough money? I mean, doctors do get paid well in this country, but that's partly because they have huge debts in this country that are paired together with having the training and the certifications that they need to be doing their work. So it's this very holistic, big systems thing in my head that's all kind of connected together.
yeah, it's all, and I think you can root it all as you did. It's all rooted in debt, and it's all
Mhm.
rooted in people feeling like they have to repay themselves through other people, right? And this is it's just this endless cycle of debt to someone else. And I think you're totally right. I think there is a excellent connection to be made between making college free, and then graduates can feel confident to go and do their jobs to serve the community, not to serve
Right.
the people they owe money to. These endless debts. It's actually, I've worked super super hard for 5 6 years, however long medical school is, and I can actually take the skills I've learned to keep my friends and family healthy, because that's what healthcare should be, especially on a local level.
Right. Yep. Yep. Absolutely. Yeah. Okay, great. All right. Well, good. Well, this has been a really good conversation. Is there anything else, any other rabbit holes you want to go down?
No, I just think it's so important we keep talking about it and making these examples, because it's easy for people to forget if they don't have a direct relative
Mm.
who needs medical care. We all have a friend who isn't talking about it. We
Right.
all have someone in the community who is in desperate need of healthcare, who cannot afford it and is scared to go to the doctor. And there's a genuine fear about healthcare in this country. And I think we should totally spin that and make it positive and think we should all expect so much more from our government to care for us, and for us to care for each other. And I think
Yeah.
that is absolutely rooted in college for all, and definitely, Medicare of some sort for absolutely every person in this country.
Right. Good. Yeah. I mean, this is one of the reasons why, like, one of my growing themes in this campaign is ask for what you actually want. Because when we start out from a compromised position, like, all these people are saying, like, yeah, I would love to have single payer, but I think what we can actually get through is like a public option. And then instead of asking for single payer, they're asking for a public option. And then what we're going to get is like tweaks to the ACA, which is like private insurance subsidies, which has been life-saving for a lot of people. Like, I am grateful that it's there. Like, my own family is on the ACA, but it's like it is a very poor substitute for like single payer, which we actually
Absolutely.
should be at. So Okay, great. So I'm going to wrap that up. So again, if you want to watch that whole video, it's on our campaign YouTube channel called Johnny versus the Scary Socialist. And it's a pretty fun video with bouncy music and everything. So folks turn in on Thursday. I'm going to be doing a special session. I'm going to have a special guest with me, Carl Beach, who is a progressive running for the U.S. House seat, is going to be with me on Thursday, and I'm going to sort of introduce him to folks who have been following my campaign. I think Carl's great, and has a really terrific platform, similar to mine. We're not identical by any stretch, but we're pretty similar, and I'm excited to have Carl having stepped into the race. And I also need to remind everybody, just a quick thing, this was paid for by Yana for YO, and we definitely approve of this message, right, Glenn?
We do.
Okay, great. Thanks so much for tuning in, everybody. We'll see you on Thursday.